For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm today's host, Melissa Hodgson. National changes in healthcare can be felt right here at home, and one of the ways St. Tammany Parish Hospital has worked to ensure world-class healthcare close to home is to partner with Ochsner Health System. When these two organizations partnered, they set out promises to the community, a shared commitment to patients that meant collaborating to build on strengths and bring more specialized expertise closer to home than ever before. The partnership is now 2 years old, so today we have guests from both organizations to tell us a little bit about how their partnership is improving care locally. We'll speak with St. Tammany President CEO Patty Ellish and Ochsner North Shore Region CEO Brad Goodson. Good morning, Patty. We're glad you could join us.
Thank you. I'm very glad to be here.
Thanks for coming in. You know, I think what we want to start off with, if we could, is talking about, with the partnership, one of your initial promises was to increase access to care with a focus on subspecialty care and some of those areas of specialty that maybe were hard to recruit into our area. So if you can talk a little bit about how that's going so far.
Sure. First of all, our numbers together are up significantly. Obviously, reaching more households, having access to more care in our community means the folks are seeking out our care together. So we're real pleased. We're seeing over 6% more in terms of number of visits that we've achieved when we were by ourselves. So the combination and the effort between the two organizations have definitely opened up access for more individuals so they can seek care close to home.
Great. So that's more people in our parish who can stay in the parish for care.
Sure.
And that level of specialty care that you were aiming for, you hoped to bring some neurosurgical capabilities?
Some of the hardest to recruit specialties we prioritized first. Where there might have been clinical care gaps, those harder to recruit specialties we sought, specifically around neurology, neurosurgery, and pediatric subspecialists. We launched a neurosciences program in early 16, and I'm very pleased to report that has been extremely successful. Our neurosciences program was very comprehensive, non-surgical, surgical, and stroke-related patient care. Resources are around that new Neuroscience Center of Excellence. As a matter of fact, right off the bat, in January of 17, we're getting ready to add to the St. Tammany Parish Hospital campus a 4-bed neuro-intensive care unit, the only one on the North Shore. But it's not just neurosciences that was one of those hard specialties to recruit. We also initially had combined our 2 cardiac catheterization laboratories. That in and of itself combined to afford us with some efficiency in operations. But in reality, we were able to bring about more of that care closer to home. We've grown some 30% from being together. Has proven to really increase that access from our prior periods when we were doing things by ourselves.
Okay, so 30% more area residents are able to have really high-level heart care right here close to home rather than have to travel further away for maybe interventional care.
Well, that is true, so much so that on the drawing board for 2017, we're planning to expand to a 4th cardiac catheterization room, bringing those not only cardiology specialties, but cardiovascular surgical specialties inside of our hospital. So that growth has allowed us to continue to reach out to that need and bring that care closer to home.
Super. And those are both specialty areas that we've been able to see grow in the parish for adults. But then there are also some exciting things that you and Ochsner have done together for the pediatric patient.
Oh, absolutely. The care of our littlest patient right here on the North Shore. Folks won't have to travel to the South Shore in case their child needs that specialized care. We're real pleased to be able to offer combined pediatric subspecialty care now on site right on Highway 22. We've opened up our pediatric subspecialty clinic, which includes physician specialties around neurology, around cardiology, around gastroenterology, and our newest addition at St. Tammany Parish Hospital is a pediatric orthopedist. You know, for us, it's really bringing those professional specialties on the North Shore, so folks don't have to travel to seek out that specialty. We're real excited. Opening this month is St. Tammany Parish Hospital's Pediatric Emergency Department. So once again, we've always cared for children in our emergency room, but now we have that specialized facility to be able to devote to the parents, to those children undergoing those scary times when they have to seek out emergency care.
Sure. Now, so if you're a parent in West St. Tammany and something unexpected happens at home or out and about with your child, you can know that you can load that child up and come on to the emergency department, and that there's an emergency resource that has pediatric capable nurses, pediatric specialists, and that Ochsner subspecialty clinic backing it up.
Absolutely. We're real proud of that. That's been something I think we've heard resonating from our community, from parents, from physicians, from pediatricians who said, let's not forget our littlest patient. And so to be able to offer that advanced level care in our emergency room, and I hope that if we're doing this in 2017, we can continue on understanding what those specialized needs are, maybe in the future offer a pediatric intensive care unit.
Outstanding. And I guess the pediatric orthopedist working directly for the Bone and Joint Clinic, which is a part of St. Tammany Parish Hospital, coordinates very closely with those pediatric specialists in the Ochsner Clinic.
It does.
As they're right there together.
That's correct.
And they're both backing up the hospital and relying on that pediatrics unit in the hospital, as well as, you just said, a pediatric emergency department. Very exciting.
We're really pleased to be able to showcase them when two organizations really focus around the care for the community. This is really the best that you can find regionally. We're so excited.
Outstanding. Well, all right, so that's a lot about the specialty care that's maybe new to West St. Tammany, or some of the things that we've been able to augment or build up here in the parish. But you can also talk a little bit about technology and efficiency that's been improved as a result of partnership. Is that right?
Yes, of course. Initially, we looked at our sleep capabilities to offer sleep studies. That was one of those technology areas that we both had, and so instead of duplicate, we combined those resources. Not only did we combine them and the staff working together, we've been able to expand that ability to care for some, I guess at the end of this year, some 1,300 sleep studies that, again, year-over-year improvement has shown that growth has been well received in our community. So that, coupled with probably one of the biggest launches of technology that we've undergone in my tenure at St. Tammany, has been the electronic health record. So we're extremely pleased to be able to say that our EPIC electronic health record will allow patient information systems at St. Tammany and Ochsner to really be able to have access to that. So those specialists working together with their primary care physician can really see the care that's delivered across the continuum wherever that care is being performed. So whether it's at an Ochsner facility or a St. Tammany facility, there's no need for duplication because the professional staff can see what's been done for that patient. Not only that, the patient themselves can get access to my chart where you can look up your own information, which has certainly been something that I know our community has welcomed. And so we're really excited about the technology advances. That in itself was an outstanding work that's been done to implement that and then to deploy that out to all those resources. So.
Wonderful. So EPIC basically is the professional piece of it, and my chart is what the patient would experience, but it's all that same electronic record.
It is.
So if I'm a patient and I have a procedure at an Ochsner facility and I'm back to see my primary care physician at the St. Tammany Physicians Network, my physician's going to be able to see that work that was done at Ochsner and vice versa.
That's correct.
And they'll be able to share diagnostics, like if I need an x-ray or if I had lab work. Everybody that has a right to look in that record, regardless of whether they're Ochsner or St. Tammany or me myself. We get to see
Indeed.
that same information.
Sure, and what you gain from that is you avoid the duplications that might occur from one specialist to another. It avoids that redundancy, and the efficiencies that gained is that it's more streamlined care for the patient. In the end, it's really the technology's there to afford us this opportunity, and because of the partnership with Ochsner, we were able to deliver that at a significant price break that otherwise on our own St. Tammany Parish Hospital would have been limited in its choices, and because of the partnership we were able to take advantage of that shared pricing as well.
Wonderful. So we got the best possible resource by
Yes.
pairing up.
Yes.
And it sounds like, too, what you're saying with the reduction in duplication. So, for example, if my primary care physician had required an MRI to have a look at something, and then later, a short time later, I'm there to see an orthopedist, possibly what that orthopedist can see from the existing MRI might mean that I don't have to have another diagnostic test. Or if I do, that now we can use the old one and the new one to see what's different.
That's correct.
Wonderful. Great use of technology for better care for patients.
Oh, we're so excited. We're so looking forward to what the partnership can bring, and I think we're already set our sights on strategies and goals for 2017. So not only with the opening of the new emergency room, with the advancement in the neurosciences center, the pediatric subspecialty clinics, all for advancing care and allowing our community to really take advantage of that quality health care close to home.
Super. And elevating that level of quality care available here in West St. Tammany. We've even seen in this partnership that you are receiving patients who might otherwise previously have traveled much further away, and that's through a referral system. Can you tell a little bit about that?
I can. Indeed, that the partnership with Ochsner is not just located on the west side of St. Tammany. It's a regional approach. And so using the regional referral center, we've not only seen that patients can go to the South Shore Ochsner main campus, but quite differently that you might think, St. Tammany Parish Hospital is receiving those patients from outlying areas where they would have to travel farther from home. Instead, they're able to access our care locally. And so there's been more transfers to our hospital from the region than there has been transfers to the South Shore.
Oh my goodness. So keeping care closer to home.
Indeed.
Good. Okay, well, 2016 sounds like it was a great year of development for this two-year-old partnership, and it sounds like you've got a lot on schedule for 2017. It's going to be a good year.
We're excited. I can say honestly, looking back, time has flown. The opportunities that exist for us together, there's no doubt we're better together.
Better together. Fantastic. Well, Patty, thank you so much for coming in and talking with us. We appreciate your time.
You're welcome. I've enjoyed it.
Thanks. And next we'll talk with Brad Goodson on how the first 2 years of the partnership have worked for the region's healthcare leader, Ochsner Health System.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living. As we examine the progress two of our parish's leading healthcare providers are experiencing as they progress in a partnership designed to increase quality and access to care for residents of our parish. Building on what St. Tammany CEO Patty Ellis had to say, we next speak with Brad Goodson, Ochsner's CEO for North Shore Operations. Brad, thanks for joining us.
Thank you for having me.
Really glad to have you here. One of the aspects of the partnership that Ochsner brings is innovation, particularly with regard to technology. Can you tell us a little bit about how the two partners are doing with the initial promise to bring telehealth into the parish?
Absolutely. So, at the beginning of the partnership, we set out to really bring more highly specialized care and access to that specialized care into the partnership. And we're actually doing it through a virtual capacity as well. We have some boots on the ground, obviously, with the great work that we've done in neurosciences, but certainly we wanted to bring more access to specialized care in a telehealth capacity. So at the beginning of the partnership, we actually implemented Ochsner Care Connect 360 telestroke program, where we actually placed this in the emergency room at St. Tammany Parish Hospital, and you can imagine how they've seen some robust growth in the emergency room itself. So we've provided that access to the Care Connect 360 program in the hospital itself. Thus far, and over the course of the last 2 years since the implementation of the Ochsner Care Connect 360, 186 patients have had access to this technology, and they always say time is brain, and having that level of technology and that access to those subspecialists, even in a virtual capacity, has allowed and profoundly saved and changed lives as those patients, entered that emergency room with a devastating stroke.
Beautiful. And I know that St. Tammany Parish Hospital actually was the first community hospital to join up with Ochsner on telestroke, even before the Care Connect 360 existed, that predecessor program that Ochsner launched statewide.
Yeah.
And so I think there's about an 8-year span of history where we've worked together with Ochsner's vascular neurologists and our emergency department, saving and changing lives.
Absolutely.
We are very proud of that stroke designation and the ability to respond to stroke emergencies through our emergency department.
Yeah. And as we move forward, we certainly want to bring more telehealth opportunities. We're looking at virtual support as St. Tammany expands their PICU to provide ePICU backup coverage. So that would be critical care specialists, pediatric specialists, providing even more oversight to ensure high quality outcomes for the littlest of patients at St. Tammany Parish Hospital. In addition, we're looking at the eICU, which is electronic ICU, that again brings that similar capacity into the ICU setting. So you always have 24/7 backup coverage to ensure that we get the highest quality outcome for those patients.
That's outstanding. So what you're describing then is St. Tammany Parish Hospital has ICU and CCU, has had for a very long time, has NICU, is looking at opening PICU, and you're talking about the technology where Ochsner has its specialists across the lake in special rooms with special technology so that they can back up those doctors who are at our hospital, so that we have the intensive care unit backed up by the e-intensive care unit and the pediatric intensive care unit backed up by the e-PICU.
Yeah.
That is brilliant.
Yeah, we've actually seen tremendous decreases in mortality as a result. It's great having another set of eyes to ensure, again, the highest quality outcome for those patients.
Outstanding. And certainly, two heads are always better than one anyway, but then when one of those resources is actually subspecialty care, that can bring a level of perspective and expertise that maybe isn't available right here close to home.
Absolutely.
Very good. Okay, well, it sounds like significant progress then and highly specialized resources coming from across the lake. On another note, though, when St. Tammany and Ochsner first partnered in 2014, one of the early promises was with the physician community to kind of talk about how collaboration makes patients safer and provides physicians a better environment for practicing. So can you talk a little bit about how St. Tammany, Ochsner, and our private practicing community physicians are collaborating together in West St. Tammany?
Yeah, certainly as our community and our region face increasingly complex challenges around healthcare.
Oh yeah.
It's important for our physicians to collaborate in a positive fashion and share best practices. So certainly the St. Tammany Quality Network, clinically integrated network formed by St. Tammany Parish Hospital, is now working with the Ochsner Health System, and they're collaborating on specific healthcare quality initiatives and structure proactive management around diseases to ensure, we share and demonstrate collaboration and get high quality outcomes for our patients. So that's, it's great seeing that level of collaboration between the Ochsner physicians and the St. Tammany Quality Network to proactively manage those disease states.
Okay, so for chronic conditions then, like diabetes or COPD, maybe CHF, we have some clinical care pathways and things that we're doing together?
Absolutely. So, certainly we build upon each other's knowledge. We've learned a lot from an Ochsner perspective from St. Tammany and vice versa. So, we've actually worked in a collaborative fashion around the early detection and aggressive treatment of sepsis. And we've seen tremendous outcomes and reduced mortality as a result of that collaboration and those efforts. We've developed comprehensive wound management program so that we can reduce the debilitating effects of wounds. We're working together around a post-acute strategy. A lot of the care goes beyond the four walls of the hospital. So how do we ensure high quality outcomes as they exit the acute care setting and go into that post-acute setting? So we work in a collaborative fashion to ensure across the entire continuum of care that those patients are receiving high quality health care. Another example of that collaboration is around joint and hip replacement.
All right.
So certainly, we've seen some tremendous change in the technology around that, but certainly there's preset pathways that can ensure that you don't have an infection or something of that nature. That
Find yourself right back in the hospital.
Exactly, and we want to avoid those readmissions back in the end of the hospital.
Right. Okay, so the idea behind the collaboration is to have the community physicians, the hospital, and Ochsner all understanding kind of the same ideas about how these clinical care can be provided so that the patient themselves becomes healthier, gets back on their life, and doesn't wind up right back in the hospital with another issue.
That's exactly right. That's exactly right.
Fantastic. Well, certainly what that hopefully means is that the three organizations, the independent physicians throughout the parish, St. Tammany Parish Hospital and Ochsner, are helping to keep our already healthy parish even healthier. I know St. Tammany statistics suggest we're a pretty healthy place, but we in healthcare know that there's particularly chronic diseases, a good opportunity for better management. And then you can talk a little bit about some projects we have coming on the horizon and what's next for the partnership. Particularly, I think Ochsner and St. Tammany represent a significant part of the St. Tammany parish economy.
Yeah, absolutely. So coming up over the course of the next year, we're expanding our covenant clinic. So we're really excited about this expansion effort. We're investing in expansion to add 43,000 square feet of new space, and it's really focused around physical therapy and the therapies, sports medicine, as well as neurosciences. I know we've invested a lot in recruiting resources and create a world-class neuroscience program, and we want to, replicate the healthcare setting to the great quality that they're providing. So, that's something that we want to bring to the table. So that's something that's very exciting that's coming on in the first quarter. It's really going to be open in the first quarter of 2018.
That's fast.
Yeah, it is.
A year and a quarter.
Right. So, we want to make sure that our physicians and our caregivers have a high quality setting to provide the care that they deliver, and this is going to be a first class setting even with sports performance training availability right there on site, where our physicians can oversee the performance and therapy of somebody that might have been injured in an orthopedic related injury.
Okay, so if you have a patient who's having orthopedic care, once this new facility is available, they'll have sort of indoor and outdoor opportunities for the therapy and exercise and all of the aspects that come after surgery and some of the inpatient care that would occur at St. Tammany Parish Hospital.
Absolutely. So with the athletes, you want to kind of replicate what happens on the field. And so we're building a 50-yard field so we can actually replicate those movements to make sure they're really prepared to go back on that field and we don't see a reoccurrence of injury. So that's part of what we want to bring to the table with the expansion itself, is that direct physician oversight to really ensure that those athletes are ready to go back on the field or the court.
Well, and in this area, certainly when in the first segment of the show, we were talking with Patty Ellish about the pediatric subspecialty clinic, about the pediatric orthopedist, about the pediatric ED. We've got so much there for young children and for teenagers. And it sounds to me like we're also keeping that in mind as we're developing this opportunity for more physical therapy and for the neurosciences, that we anticipate a lot of the folks we'll see will be maybe our local high school athletes and even some of our adults who maybe are in soccer and some of those other kinds of sports that have a tendency to bring about certain injuries. And when they're rehabbing, they can be out on a field and with their medical providers.
Absolutely. So we have a unique partnership with all the St. Tammany public schools where we place a trainer in for a lot of the high schools across the entire parish. So this will really, have that connectivity between what they're doing there from a training perspective in the actual school into the actual clinic setting itself should they have an injury, so we can make sure we're communicating effectively across the entire continuum, and again make sure that athlete is truly ready to go back on the field of court.
That's fantastic. I think that sounds a little bit like we're doing exactly what the partnership said. We are taking a look at who our population is and what their needs are and what the gaps are for us to bring that health care closer to home. And together, Ochsner and St. Tammany are figuring out who can bring what to the table to really provide that level of care that people in this area expect and deserve.
Absolutely. So the whole premise of the partnership was around enhancing access, creating value, which is increasing quality outcomes, which we're doing when we talk about the physician collaboration with the private practitioners, the St. Tammany practitioners, and the Ochsner physicians. So all those three are enhancing outcomes and providing higher quality. At the same time, we're lowering the cost and avoiding some of that duplication of services. So that's, when we talk about what we wanted to accomplish and we set out as part of this partnership, it was certainly around access and value.
Right. It was kind of in national healthcare circles, you hear about the triple aim.
Right.
And that's very much what our partnership represents. For St. Tammany Parish Hospital and Ochsner, you're looking at how can we increase quality, improve the patient experience, and bend that overall cost of care back into more reasonable levels. And that elimination of duplication not only helps with the cost, it's an aspect of what brings about safety and quality, because a patient who is in that electronic record and whose caregivers are all seeing that same information, that's not only more efficient, that's safer care. Outstanding.
Surely is.
Well, Brad, thank you so much for coming in. We really appreciate your time and your perspective from Ochsner's side of the partnership.
Well, thank you for having me. 2017, we talked about a lot about the expansion efforts and what we want to accomplish, and it's going to be an exciting year.
Super. Well, this has been another episode of Healthy Living brought to you by St. Tammany Parish Hospital. Join us again next month when your regular host Amanda Paxton will be back with another exciting episode of Healthy Living.